Great. Okay, so this first part of the document, we just wanted to add a little bit more of the introduction because I think a number of people said, well, what's the purpose of the principles? Can we clarify? So we just added here, Duke Margolis, some language that just talks a little bit about, the days that we met and the types of folks that were in the council, and then the purpose of the principles that can really, this is a sentence, can aid the governor and legislators in the development, review, and enhancement of a successful plan to increase affordable, quality, and comprehensive healthcare coverage for North Carolinians. So I thought maybe we'd start with this paragraph here just to see if anyone had any thoughts, concerns, refinements, improvements. Anything to share there? You all love it. So
it's good.
Okay. Did I leave any, we want to make sure, do we leave any members of the council out, like by category? We tried to capture everybody. That was one question I had. So hopefully we got everybody. Okay. All right. I keep going. Sounds like everyone's good.
Mm-hmm.
Okay. Thumbs up. Okay. This next paragraph that we added, there was a couple folks that wanted to just mention COVID-19. So we added a sentence around, recognizing that COVID-19 has created a lot of challenges, exacerbated existing challenges. And so just identifying how these principles can help North Carolina during the pandemic, but also beyond. So that's basically the purpose of this edition. Let's see if anyone else had thoughts or concerns or improvements. No, everything good? Okay, just chime in if yes. Everything's okay. All right. Okay. Now we're going to talk about these draft principles, but along the way, I also, if there's things that may not get written into the document, but you want to talk about and make sure it's reflected in the meeting summary, or things that could happen afterwards as a result of the principles, please feel free to just elaborate on that. I really want this to be more of an open discussion, not just about the words on the page. So, Senator Bergen, were you coming off of mute, or just was that an accident?
No, I think I'm just off mute right now. Thank you.
Okay. Yeah, go ahead, Erica. Yeah.
I have one thought, and I don't anticipate this changing because I'm bringing this up, but I feel like I would be remiss not to. So in the first bullet point, we specifically state access to affordable comprehensive health insurance. And then we have a list of multiple solutions that I think throughout our time, there have been a host of great reasons why many of these have good qualities that could be beneficial. There's one exception to that, and I think it was sort of skirted past in an earlier meeting, I think in our second meeting, about promoting enrollment in bronze plans. And I think it was sort of, these plans are there, you can jump on them for free at a certain level, but I think we skirted past the affordability aspect of that. So the reason that those plans aren't being jumped on is because they on average have about a $6,000 deductible. And so for an individual to qualify for that for free would be around 100% of the federal poverty line. And so if you're making $13,000 a year, $6,000 as a deductible, I think there's maybe, I wouldn't call that affordable. There may be disagreement on that, but I think I just don't want us to push past having a potential option that involves someone spending 50% of their annual income when they're at the poverty level.
Yeah, that's a fair point. We can bring that back to the group. I wonder, it could also be just promoting enrollment in marketplace plans.
I think that would be a fantastic, yes, because and to that point, there are silver level plans that are subsidized maybe at a less affordable level, but offer a better possibility. I just think kind of focusing on those bronze plans with that level deductible isn't necessarily where there would be as much consensus, but I do think if we were to, in the place of that, promote enrollment in existing marketplace plans, that to me would make a lot of sense.
Okay. Great.
And I
Okay.
agree with you, Erica, because to me, I agree that it shouldn't be the bronze plans, but even in promoting enrollment and market-based plans, I think there would have to be some kind of incentive, considering that we're talking about people who are the working poor, who are uninsured. So there would have to be some other kind of incentives to help them to enroll in that. So I agree with you wholly.
I'd like for us to also look at health savings accounts associated with the plans where maybe even the state puts money in an account for someone that they can use to offset some of those deductibles, or if we went to a Georgia type plan where there was a premium, they could use it for any of those things. I like for people to have some say in their health care and what they do.
I would echo, I'm sorry to talk so much. I would echo that as well. I think we heard today for the first time about one particular member rewards HSA type account that another state has implemented. And I think we've seen examples of that in some other states like Indiana, New Mexico has a program. I think that is certainly something that there's probably a lot of interest in exploring further.
Who do we know? Was this a wider group suggestion to put the bronze plans in? And if so, I think just to be fair in bringing since everybody's reviewing all of these, I guess, was it just our group that's reviewing these?
Everybody is.
Everybody. So
Yeah.
if other people wanted this in, then I think we can certainly make our comments, but I would hate to just recommend that it be taken out without having some input from the people that put it in.
Yeah. Yeah. And when we come back together, we can ask about,
Okay.
Yeah, absolutely.
And that's kind of what you're doing with all of these, aren't you? In terms of
Yep.
any changes we recommend. Okay.
Yeah, we're gonna talk about it as a group, and so people can, because I don't remember who exactly asked for that change to the promoting bronze. So we definitely want to hear from them and talk through this suggestion and see if that makes sense to them. So, yeah. Okay. Any other suggestions on this first one? This has been great. Okay. All right. Program simplicity. So this was a new one. I think there was a lot of interest in, that things are complicated. Our healthcare system is complicated. And so making sure, whatever ideas come about, that they should be simple to navigate for consumers and providers. Any other refinements or thoughts on that one?
That would be an amazing feat if we.
Yeah. You all get the gold
None
star.
of our current systems in healthcare are easy to navigate, so that would be an amazing feat to accomplish that principle.
Yeah.
I think I would add where you have consumers, some parentheses that says, especially for, we talked years ago about the literacy level at a 6th grade level. But I think we need to make sure there's some provision for consumers who are at we don't need to say it like that. We need to make sure that it's not for people like us to understand, and we don't understand at halftime, but at least at the consumer level, at the 6th grade level or high school level, somewhere like that, because people can't understand this language. Half the time we don't understand it.
Yeah.
Senator,
Sandra's
that's
nodding her head.
Yes, that's true.
why I thought they put that in there, Senator, was for us.
No, they excluded you and me.
I can't understand it. So, and I just want to add, I agree with the simplicity, and also being that we're in COVID, just maybe the ease of availability, meaning that, it's online, or if it's the applications are in the health department, just how can they easily capture this information? You don't want to make it hard that they have to go way to Timbuktu just to get a paper application or something like that. So maybe trying to think of the exact word, but ease of obtaining the application.
That's a good
And
idea.
this is Deborah Farrington with Medicaid. We have some systems in place now where people who want to and have access to online options can apply online. So I think calling that out is a really good idea, that people have multiple ways to be able to apply for whatever we make available.
Yes, thank you.
Okay.
Great.
I think at some point we were going to talk about strategies to make this accessible, but like
Yes.
I would love it if someone could call on a phone and talk to someone for help. I mean, that, you know, I'm 42 years old, and if there's a phone number, I'm probably going to call it, because and I feel like there's a lot of people that's the first thing they would do, and unfortunately it's not where our culture is moving.
Right.
But that's just
That's great. I think that's great, Vivian. Even the access to, and they may already have it. Deborah may already have that when they talk about like text options and things like that, because that is, you know, kind of where we're at right now.
Ms. Howard, I agree with you, and but I think that we need to have another caveat there, in that we have not only a phone access, but a phone option, but a person that actually answers the phone. Because that is one of the major, the biggest complaints that we get from state government and the different departments, is that you can call for hours and you never get an answer. And so that we should, you know, if we're going to have the phone option, it ought to have a time sensitive response.
Sort of a live voice response is basically what people want.
Yes.
I think one of the more frustrating things, getting called into a phone tree.
Oh boy. Yeah.
And that's what's happened with the vaccines as a way. As a
Okay.
matter of fact, that's what one of the major complaints with us.
And this is Cassandra, and just had another question as we're talking about, you know, how to implement the plan. And Hemi, when we talked about the price tag, was that including like administering the plan as well, like having the phone operator, you know, because of course it costs to have these people in place. Was that including all of
The
that or no?
the administrative costs, we can confirm with Julia. I believe yes.
Okay.
But we can confirm that when we come back. Actually, I'm
Right.
going to put a
Okay.
note here.
Gotcha.
Yeah. Want to make sure the actuary agrees.
Yeah. I know payroll costs oh too well.
Yeah. Okay. All right. We'll ask her. Okay. Great. Okay, let's keep moving. This is great. Enhancing the health of North Carolina. So this was just, I think, a general addition, very broad, and, you know, laudable goals with not a lot of specifics. The next one was health system sustainability. The next sustainability and efficient use of taxpayer dollars didn't change much from the last time. But in just reading maybe these first three, anything else that you would want to add?
Well, you know, I'm looking at number 2, and I think one of the major pieces we just talked about, at least I asked Dr. Thorpe from Georgia, gets to the small rural hospitals. And while all hospitals and providers have some issues, I think in North Carolina, we need to kind of point out in this that we need to invest in the fiscal sustainability of bringing back those rural hospitals in you know, our areas that haven't been able to sustain themselves. We need to have some emphasis on that, because our folk live in those areas, and if they don't have hospitals to seek care, then we're missing a lot of folks. So I'd like to see some emphasis on our rural hospitals here.
Yeah, there and Senator Robinson, there's a bullet underneath saying strengthening our rural communities.
Okay,
Um,
okay.
Yeah, so there's
I
a
see that.
reference.
I'm sorry.
Yeah.
Yeah,
No,
okay.
no worries. You know, if there's anything else to add there, but we do call that out specifically because I know it's
Okay.
a concern.
Okay.
Yeah. Okay. I'm gonna take that out maybe. Okay. Anything else before we keep moving down the page? We have one here, solutions to increase healthcare coverage should prioritize reducing disparities by geography and by race and ethnicity. So that one was refined since our last meeting together.
Kimmy, I did have a question. Maybe I'm missing it. It's when we talked about efficient use of taxpayer dollars. Didn't we have something before where we were going to put that the hospitals and insurance companies kind of had to pay, I guess, an amount as well, like their input to help offset the cost?
Yeah, we talked about that. You know, I think because it's like that's kind of a details like strategy piece, I think it's more about considerations of how this would actually be able to happen would be, you know, hospitals and health plans would have to contribute to help pay for all of this. But we weren't going to kind of write it in the principles. I think what we could do here is we could add that as like something that, you know, in implementation, sort of any solution would have to require, you know, or likely require hospitals and health plans to help, you know, pay for some of the solution.
Mhm.
I think,
Because we called out the taxpayer dollars and,
Yeah.
I think, just to call it out some.
Yeah.
As a taxpayer, you'll say, well, you're not the only one footing the bill on 500,
Yeah.
I'd like to recommend that we consider putting a period after payer funds. To include that next phrase, we're really kind of, as we've heard before about the discussion over the Georgia model and the
Yeah.
different issues that came there. So basically, by adding that last phrase, it's like we've already made a decision that we're going to go with the 90% match. And I don't think that that's the decision that everyone has made yet. And so I don't want something. I would recommend that we not include a phrase that already limits what we've been trying to do here is have a broad perspective of options.
Okay.
I think we need to put a period after payer funds.
Okay.
And if we do that, then I think we need to include after that somewhere that says where Medicaid or expansion is consider optimizing matching. I don't want to take that out totally. I'd like to include a provision there that says where Medicaid expansion is an option, include optimizing federal funds.
Well, it depends on what option we choose, and that
Right.
would, and so therefore to put that phrase in there, it indicates that we as a group are saying that we've already decided on the maximum option, the 90% match. And I don't believe that is, I don't believe that's, if we took a vote right now, I don't think that would be a full 100% vote or the majority vote. Maybe it would be the majority vote, but it still doesn't allow for that discussion and option of different models. If we already say that we are going to choose the model that has the most, matching federal dollars, because there are other issues other than just, choosing that option. And there are other options as we've been discussing over the last 4 meetings. So I just feel very strongly about putting a period behind funds.
Well, Georgia didn't do 90%. They did 67%. So I think we have to have this in here somewhere. So, I think we have to have it because it doesn't say 90%. It says, optimizing depending on the model we come up with. So Georgia didn't do 90, they did 67. They did with the 1115 Medicaid waiver. So there are several possibilities, but we have to include it as a possibility in here somewhere.
Could we phrase it in some way to say that it would include a discussion on that, so that it's not something that's left out of of any conversation that
Right.
moves forward, so that it's clear that it's a discussion that we've had, but without tying legislative hands to any
Yeah.
type of proposal.
Right.
So here's a, I'm just going to throw out a straw man here. So if Medicaid expansion is an option, consider different financing, which may include, we could put in optimizing federal funds and relying on hospitals and health plans.
That's fine with
That sounds
me. I
great.
don't know about everybody else. Jim,
Yeah, I
what do
don't-
you say?
Yeah,
I would rather, well, I'd rather leave the language like it is. It says, because maximizing funds does, you know, when you put in the word Medicaid expansion, that
that
immediately,
changes.
That does
immediately
slant.
change. I'd rather stay where we are. And Hemi, I cannot find, did we get any notes about the Georgia presentation? I'm sitting here trying to, what was the waiver that he mentioned that I was not familiar with? But what was the waiver that he talked about?
The 115 waiver.
Was it the
1115
115?
1115.
There's
Mhm.
1115.
That's
1115.
1115 waiver.
And I want to explore that a little more. Do we have those notes? Have we been sent those notes?
No,
he-
you're going to get those slides right
Okay.
after this. Yeah.
Uh, I was sitting here trying to see if I had them in any file. I just wanted to read over that because that's something else that I want to examine more waivers. I think there's things we can do with some more waivers.
Yeah,
Right.
And North Carolina
I think
has
that's right.
1115 waivers now for different, different programs that's in Medicaid already.
But we didn't have it for the particular one that he was talking about.
I was-
Right, we don't have that
I'm
one.
very familiar with the 1115 waiver process because we already used those, but no, it was not related to what we've been talking about today.
Right.
I would say from the perspective, and I represent a coalition, obviously, that's focused on closing the gap. But I would certainly, from my perspective and the coalition's perspective, not want anything in here that would close the door to a conversation on how we find a pathway forward. So to that extent, while I think that the optimization of funds is important, I would certainly just want to add that Representative White's point about not having us close any doors before we get started is an important one as well.
And
I don't know
sometimes,
if that's helpful.
thank you, Erica. We're all dealing with our groups of people that feed us information, and we know how they interpret language. And something of this phrase, I think, and I certainly bow to Senator Robbins and Bergen's comments, but I just know that phrase will turn a lot of people off, and this discussion could be ended very quickly without us being able to move forward to continue to collaborate. So that's why I was concerned.
Yeah.
But the other thing too is federal funds, you're going to consider them regardless of what you do in some form or fashion. We're going to have to consider, how do we pay for it? What is our share of it? Where does it come from? Are there pots of money from the federal government through some waiver we can get, et cetera? So I think if we take it out and other people have put it in, we didn't put this in, then we take out any possibilities of looking at options, is my concern.
What if we softened it by including by considering use of federal matching funds and other sources where possible? That.
That's all right with me.
So you're not boxing yourself into any particular type of.
You just say if federal matching funds are available, they should be optimized as well, or something, like without using the Medicaid expansion word.
Right, because it doesn't say that. Yeah. Take that out.
Representative White, what do you think? Because I know you had brought it up. What do you think as far as wording, not to box us in?
Yeah.
Well, I think I've said I think enough. So the group rules. So I think I've made my decision.
We're all in this together.
Yes, yes.
Mhm.
Well, I think we'll bring it back to the group about considering whether to delete that whole last phrase or whether we want to try to find something that's not, could be more palatable.
Could we just
So-
insert the word by considering the use of federal matching funds so that it's clear that it'll be a part of the conversation, but not that we'll do any certain thing?
I like that. I like that, Erica.
Yes, okay.
And then,
Including by-
Hammy, you need to, and in the presentation, you need to point out, this kind of discussion here to let folk know that there were some concerns right in here as well.
Yes, I'm gonna highlight this.
Okay.
So so that people can see. Okay, yes. All right, great. Thank you. This has been a really good discussion. All right. If we're ready to move to the last few, expanding access to and coverage of behavioral health services. We added a footnote on insurance parity to explain what that is, because I think a couple of people were like, this is complex, and it's still complex even with the footnote, but we've tried to add a little bit more to explain what parity means. And then we had in here about supporting the business community. So Vivian, any thoughts on this piece? Or Cassandra, should support small businesses, both for-profit and non-profit, who struggle to provide affordable health insurance to their employees and have been negatively impacted by COVID-19. Anything on either of these two?
I do kind of feel like this tacking have been negatively impacted by COVID-19 to the end of it makes it feel like a COVID specific thing when the issue existed long before COVID. Well, long after COVID.
Yeah.
But that's just my thought. When I read it, it read like, oh, this is because of COVID-19.
COVID thing. Yeah.
And
Yeah.
I think that could certainly hinder it being moved forward as well, because we don't know how long COVID is probably going to be a part of our lives for the rest of our lives in some degree. But I think since this was an issue for our state way before COVID was diagnosed, I guess, or transmitted to the United States, I think that the more we reference COVID, the more it could be viewed by folks that realize that COVID expenditures and appropriations and are at least in our terminology now, are considered time limited. And so to have COVID in there, I think it really kind of, it could date us as we move forward.
Yes, I agree.
Yep, great point. I will represent that to the group and recommend striking this last piece. Okay, great.
And basically, we could just stop after the period could come after employees.
Employees, exactly. Yeah, delete this whole thing. I'm going to highlight it so that can. Yeah.
This is Cassandra, just of course, you guys can help guide me. Would it also, looking at it from another angle, would it also help us to get it started in the sense, because we are getting a lot of funding due to COVID at the current, just trying to think if there would be any way to push monies in at the beginning, because we're going to get a lot more, hopefully, because of COVID. Would that even help? Because I noticed at the beginning of it, we have it reference COVID, like in the, right before the, in the second or third paragraph.
I think we would remove it from there too, but that's
okay. Okay.
With the health working groups, and well, not just the health, but all of the working groups that the speaker established in March. basically all of this was identified in some fashion and has been dealt with from COVID money. And if we do get additional COVID money, which I certainly think we probably are going to get, those core groups will be pulled back together again, and kind of hopefully assess what we've done thus far, and then what we can do moving forward to deal with these issues. So it would be kind of a double Band-Aid, but to continue to mention it in this work for Medicaid expansion or for health access, affordable health access expansion. I think it could be confusing as especially for bill drafters and folks that would have to move this forward. It could have federal connotations, I guess.
Gotcha. Okay, thank you.
It might be looking like we're mixing COVID money with state match money, with the feds. I don't know. It just,
Gotcha.
I would not, 4 years ago, I wouldn't have thought that technical, but when
You know better than me.
you try to think more about what the other person's going to not like than you think about what you're trying to move forward sometimes.
Mm-hmm.
Yeah, so Cassandra, as a nonprofit business owner, though, what I'd ask you is, because I'm trying to look at the whole sentence in context, it says should healthcare coverage options should be available, support both for-profit and nonprofit who struggle to provide affordable healthcare insurance. And to me, is there something we need to add here to further explain the difficulties you deal with people who may have high risk, regardless of whether you put COVID or not, but something to say who struggle to provide affordable health insurance to their employees, who may have varying degrees of high risk health problems, or something like that, to emphasize that. I think that whoever put this probably had that in mind. So I'd ask you, especially as a nonprofit, not leaving Vivian out as a business for profit, but I would ask you, is there something we need to include here to emphasize that?
That's a good question, Senator Robinson. I guess when I look at it from, and going back to our previous meetings, what I'm thinking about is, and I'm not sure the exact bill, when they talked about allowing them to come together to get like a cheaper option. So I'm not sure if we should call it out there, businesses, small businesses to be able to come together to provide that option. I'm actually a for-profit center. Because of COVID, it might operate like a nonprofit.
Oh, are you a for-profit? Excuse me.
I'm a volunteer. I don't know, whatever you want to call it.
Okay. I used to be a nonprofit, and a big nonprofit, but it was sure costly.
Yeah.
But I was thinking, if we take out the COVID piece, we need to emphasize something in terms of especially addressing, and we don't have to put anything in. I'm just trying to think
Right. Now,
that
Representative White, I do have a question too. Like, if we called out in the business community, like essential workers, would that too much to still be kind of going on that COVID scheme? I guess I look at it from a childcare perspective. They're on the front lines and they don't make a lot of money. Women of color, things like that. So I don't know, just trying to think, if we called out essential workers first, would that be okay, or would that kind of box us in?
But I feel like this provision or this statement here is kind of not unrelated to like who we're trying to cover. This is saying like, we want to provide healthcare coverage to everyone. And we also want to help businesses, small businesses, not for profit and for profit, to provide it. So this is like not about
It's
the
a high
coverage we
level.
provide. This is like, and we're also going to do this thing helping small businesses.
right.
Yeah. it's calling them out, to
Yeah,
make sure
right.
that whatever
Okay.
the ideas are, there's emphasis on that.
And again, it's it's what we had before COVID and what we will have after whatever we say is the end of COVID. So to continue to
Yeah.
replicate it or to pull out special identities that have been totally, profounded by COVID, I think it just takes away from our general message.
Gotcha.
Yeah. Okay.
Because if we
Pastor
can
Regan,
sustain small businesses and when we look at reducing disparities, we're kind of covering all the groups anyway. It's just, we're not using COVID as a reference.
I mean, the word
Okay.
support is so, like, it could mean any, I could put my
Right.
arm around you and support you. So I think that's where, for me, the statement is like very vague, but I know I've learned enough through this process to know that it has to be. So, yeah.
And maybe the next next bullet point gets to some of this.
yeah.
Talk about social determinants of health, et cetera. It does prevent it.
And we
Okay.
do have just a minute and 45 seconds. I've asked for a couple more minutes, but I don't know. They might make us go back. So on this last bullet, to your point, Vivian, I think support is, like, we could say, does the group have a stronger word? It may not be, or if there's something else we want to add to this bullet list here, that is more specific to small business, because this is where I think there's opportunity to have a few more ideas. I don't know if it's like targeting strategies for small business or something that's a little bit more.
This is Cassandra. I had been thinking about that broadband access, and
gonna make
also in our conversations, is there something else that it could be called out? Because I feel like it may get like tied up into things because of, that's a whole nother platform, dealing with broadband, and I don't want to, miss the telehealth access and the piece of that. So I don't know if
We could add access and infrastructure.
Actually, I agree with Cassandra. We have just received a full report from the utilities, and we know because of the funding that we've been able to put in with COVID, and then additional funding that we put in from other sources, that the term broadband has been overutilized. Broadband is pretty much available anywhere in the state. It's just that some of the services that come as a result of broadband are not available because folks cannot, have not been able to access it for various reasons. It may be finances or whatever, but it's various reasons. But I think that, again, ending it at strengthening the telehealth access, whatever it takes, but to focus on broadband, I think it really does complicate the statement.
Okay, we're gonna suggest, and they are gonna make us go back in 31 seconds. So I'm gonna highlight this. I asked for more time and they're like, no. So, so I'm gonna say for consideration of the group, taking out that reference to broadband.
I would end it at strengthening the telehealth access, because if you say that, then you're talking about whatever the issues are, it's still telehealth access.
Okay.